Enrique and Mark, just from your point of view, why is it important to work across borders? What?
Yeah, I mean, I think that, as has been alluded to already, the problem is definitely transnational. We understand, obviously, LA being the birthplace of many of the gangs we're dealing with in Central America, that there's a lot of similarities with the same challenges we're facing in the region ourselves. And so we also understand that the solutions have to be transnational as well. So, you know, what attracted us to the partnership with Los Angeles in particular are the experiences and best practices that you've brought to the work that you've done, the development of the grid zones, the tool to diagnose in particular those youth who are really at the higher level of risk of being recruited by gangs. As the mayor said in his speech, you know, oftentimes in prevention work, and principally in primary prevention, we have a tendency to want to work with all the youth who are in a hotspot community and provide them with a range of services, and that's fantastic, and that's needed. But also, how do we really focus in terms of secondary prevention work? How do we get to those kids who we know need a different kind of treatment plan? I mean, to use a public health metaphor, if we're opening up a pharmacy in a hotspot community and a kid shows up and we give them vitamins, antibiotics, and cough medicine, that's great, but do we know what they're really sick from? Do we really know what kind of treatment they need? And so the idea really is, how do we come up with a better diagnosis and a better treatment plan? And that's part of the attractiveness of the partnership with Los Angeles, is to be able to learn more about some of that work. Again, not to take anything away from the primary prevention work that we're doing, because it's obviously needed. A lot of these communities that we deal with in Central America are extremely marginalized, are dealing with a host of very serious development challenges. But as we get more sophisticated in doing this work and understanding, again, really that it is a small group of people who are committing most of the crimes, we need to do better about focusing in and really targeting those youth who need our help in a much more targeted way.
I'd like to pose it. Am I up here?
I think we got to turn you on.
Okay, turn me on.
Well, turn your...
so to speak. Am I on now? Am I turned on now? Am I on? No?
Maybe put it higher up.
It's on.
Does that work?
Did you
Actually, I'd like to pose a question to Guillermo. And you know, he's, as the mayor noted, has made a number of trips to the region for us, to Honduras, to Guatemala, to El Salvador. I want to thank Los Angeles for donating Guillermo to us. But of course, as the mayor noted, what he's doing in the region also helps Los Angeles as well. But I'm curious, from your experiences so far with us in the region and previous, what sort of similarities do you see? What sort of differences? In other words, what is truly transferable from Los Angeles? What needs to be adjusted, and what just might not work there that does in fact work here?
Well, I think transferable, some of the concepts that we've already spoken about, place-based strategies. Violence is not spread evenly throughout LA. My sense from being in Guatemala, Honduras, and El Salvador is that it's not spread evenly across all parts of the community. Two, I would say this idea of a multi-pronged approach. I don't want to use the word comprehensive because that's come to mean almost anything. But what I mean by that is doing something for the youth that live in at-risk communities. That may be the Centros de Alcance, that may be after-school programs here. Two, doing something for those youth that live in those communities but are at the highest risk. Research tells us that as little as 3% and as high as 15% of the youth that live in the most marginalized neighborhoods are likely to become gang members. So it's not all the youth. Three, building what Father Boyle calls an exit ramp for those youth who are already involved. And fourth, of course, which I think has been the toughest for LA, and it seems like it's the toughest for Central America, is that population that's in and out of prison, mainly in. So I think that pyramid of 4 levels is transferable. It's taken us a while to build it, and I think that's transferable. I think the other part I would say is more conceptual, because we keep using the word transnational only in relation to crime. LA, in fact, has thousands of transnational families. Transnational families meaning families that live part here, part there. So assuming that a family-based approach, it's a good way to reduce risk factors, then it would make sense that if this is a transnational problem, that we should develop a transnational model to correspond with what law enforcement is doing. When we think of transnational work, we primarily think of law enforcement. We don't think of community-based public health approaches in a transnational framework. That's a tall order, but I think given the level of professionalism that we've seen in Central America, given that there are really a lot of brain power involved in this work, I think that we jointly can move towards developing a model that is community-based, public health-driven, family-centered, but it's transnational in nature. So our office has been doing a lot of research on that and looking at what constitutes a transnational family. Most of my staff are part of transnational families. In other words, we need to really amplify that lens so that we could see a solution that is not just through the lens of criminal justice.
Enrique, do you want to add to that?
I mean, I would agree with what Guillermo was saying. I think that for us, part of it is what we often call the cell job in terms of the education around some of these issues with our partners in Central America. I mean, oftentimes, as you mentioned in your speech, in terms, 5, 6 years ago it was all about mano dura, and now you've seen a transition to more acceptance of prevention work. But now there's other aspects as well that we feel like we also would like to introduce, and that's the intervention piece. That's reinsertion of former gang members. That oftentimes tends to be a more sensitive subject in the region, but we feel, given what we've seen in terms of best practices here in the U.S. and in other places in Latin America, that if we really want to have success in this area of crime reduction, we need to think about the whole integrated strategy, or we joke about the comprehensive, integrated, holistic, whole of government, multi-sectoral. But the point being, how do you combine primary, secondary prevention with intervention, with reinsertion and law enforcement to really have an integrated, coordinated strategy on the ground in these communities that's addressing the whole sort of life cycle of how a youth might get involved in gangs, or whether they are involved, how do you help them get out of a gang? How do you train community promoters and facilitators to actually intervene when there's potential conflict between gangs, or to, as you know, here in the case of LA, to show up at a hospital after a shooting and prevent retaliation. These are all elements, I think, that we're sort of at a crossroads in Central America in terms of how do we sort of start moving some of our work in that direction. There's great opportunities to do that, and as Guillermo said, there's a lot of talent, obviously, in the region, but I think we're perhaps sort of at that point we were with prevention 5 years ago. We're still sort of trying to get people on board and get buy-in for some of these other elements that tend to be a little bit more edgier, perhaps, but are just as needed.
And part of getting buy-in is sort of defining terms. I think even prevention means all kinds of different things depending on what you're trying to prevent. We have used the term secondary prevention to mean the following. Based on empirical research, youth ages 10 to 15, that's the time that research tells us youth are most likely to identify themselves as a gang member. Doesn't mean that it doesn't happen earlier or later, but based on research, that's the dominant age range. And so that is the age for secondary prevention as defined based on what we're doing through the GRYD office. The other component is an individualized family plan for that youth. And Tony Brandt from Honduras made a comment while we were there, and he said that, well, youth are recruited into gangs one by one, and yet we keep addressing the problem in groups. So yes, this individualized plan Our data shows us that that's necessary and that is the most effective. And when I say an individualized plan, I mean a plan that really taps into the resources of that family. Because I think we as professionals, and I'm a social worker by training, my colleagues and I, for many years, have ignored that families do have strengths and that they can help us do what we cannot do. So secondary prevention, what we mean by that is focusing on ages 10 to 15, figuring out how we identify who at age 10 to 15 is at the highest risk, and then really recruiting every family member that we can, every network in the community, to build an individualized plan for that youth. We have found here, and again, we're still building this, that 55% of the youth that were retested in our secondary prevention programs show risk factor reductions below threshold level. Now, we're going to have to follow those youth for another 3 to 5 years to figure out if they actually join gangs. So in other words, it looks like this family-based, individualized plan is effective in addressing risk factors. Is it the old model of multidisciplinary wraparound? No, it's a community-based, driven by case managers, people in the front line approach. Is just an individualized plan. Does that make sense? So just to get terms clear, that's what we mean by secondary prevention. Now, primary prevention, as Enrique said, we think is extremely important. That's sort of the basis of the pyramid, if you will. And the hardest is, you know, what Enrique Hurtado knows and all the intervention workers in the room is what happens when those guys come out of prison. Have our communities been prepared to welcome them, to develop programs for them? All of that we're struggling with. So anyway, step one is to clarify what we mean by prevention. What are we trying to prevent?
Thank you. We have a number of questions here from the audience, and I'll read the first one. It says, you say that 10 to 15, you say 10 to 15, ages 10 to 15. Do you believe that there should be interventions for youth 5 to 10 as well?
Well, I think we should start dealing with this problem really when parents are, there's a school in South LA, I won't name the name of the school, where you see first graders crip walking in the schoolyard. So no, I think we should start much earlier, but the issue of resources becomes really crucial. So up to really in 2008 was the first time that we had a tool to identify those 10 to 15-year-olds. And it's not what I say, it's really over 20 years of research that points to that. So from my personal point of view, yes, I think that this idea of building healthier communities starts, you know, in the womb, if you will.
We have, I think, a couple follow-up questions to that, both focusing on YSET. The first is the YSET used in the juvenile halls and camps so that at-risk youth are identified before they are reintegrated into their communities?
We are, for those of you who know LA, you know that LA is massive, and the relationship between the city and the county is what we think is the next phase of development of this work. There are providers in the room that have contracts both with the city and the county, but the short answer is no. It's not being used in the camps. I don't feel that's an issue of the tool. I think that we just have to get better in collaborating between city and county, and we're one of the few cities that has both a council system and a system of board of supervisors. So the conversation needs to take place at multiple levels in order for something like the YSET, which focuses on 10 to 15-year-olds exclusively, to be implemented in other settings.
Okay, thanks. Another YSAT question, and I'd like to pose this for each of you. Can you please speak to the limitations of the YSAT tool as it relies on self-reported data? How can data be triangulated so the tool is more effective? I think this gets in particular to the challenges that we're facing at USAID in Central America, given the even weaker data there.
Well, in my opinion, any tool, whether it be the DSM-5, which is about to come out now, or the YSET, or the other tools that are used to predict behavior, they're somewhat limited. And I think that there is a downside to them. From what I know, research, which I'm not a researcher, self-reporting seems to be the most accurate way of going at it. However, we also have to rely on the vast level of knowledge of our implementers and to get feedback from them. Again, and I've said this to Enrique and sort of joked about it a lot, the YSET tool is one component, and it's been tweaked several times, and it will continue to be tweaked as we move forward with it. The idea was basically to have something that we agreed on was going to be a metric. But yes, I think self-reporting and amplifying feedback is something necessary.
And just to add from the AIDS perspective, we've done now an adaptation process that we've initiated in 3 countries in Central America, Honduras, Guatemala, and El Salvador, and it's been an interesting process to see which questions are relevant in those contexts, which aren't, issues in terms of having access to youth that we would be able to interview, issues around training service providers in these countries who would be able to go out and apply the YSET, but also the bigger challenge is making sure that we actually have a secondary prevention program in place that would be able to work with these kids once they've been diagnosed and need to be referred to an actual program. And so in terms of us moving forward, that's sort of the part that we're trying to figure out, how to ensure that we actually have that programmatic piece in place, because we don't want to end up just with an interesting research project where we've gone out and we've diagnosed 1,500 youth in these countries, and great, we've now figured out that the cutoff for risk factors is 4 or 5. Here in LA it's 4, I understand, but in Central America that's what we're still trying to figure out, and then not have anything really in place for them. So it's sort of working to try and make sure that these things can happen simultaneously, but I think we've learned a lot of interesting things from this early adaptation that we're doing now in the region.
Even what questions are appropriate to ask because of safety issues.
Exactly.
Most of our implementing partners in the office, in the room, don't have to necessarily worry about their safety if they ask particular questions of a youth. That is not the case in Central America. So even some of the questions themselves can put a provider at risk. One other comment about secondary prevention. Secondary prevention, it's not going to address broader macro issues that are very important. Immigration, guns, drugs is not, in other words, this is one component of a larger strategy. So I think we have to be careful to see it as just one component. It's not the complete strategy.
Thanks. With the significant demographic shifts and rising prominence of transnational gang activity, prevention and intervention, it seems that the magic monikers Crips and Bloods have faded into insignificance. Is this essentially true?
Well, I don't consider myself a gang expert by any means, but the way I would like to answer that is that there's been a rise in what we call transnational families. I'm also not law enforcement, so the issue of transnational crime, I'm not familiar with that. What we do see in LA is a lot of families that are living in multiple countries, and it is not just between LA and Central America, but it's LA and Belize. And then there are other countries that we have exported, if you will, taking part in exporting this culture. So I don't know, from the perspective of our office, I think the people that we have that work on the ground with gang intervention workers, I don't know that they would agree that the Bloods and the Crips have faded into less activity. I think if anything, it appears that because of what's going on in Central America, that some of those groups in Central America have a level of high visibility in the press, and we don't see that here. So in other words, if we go by data, there are 450 gangs in LA. The two that are very active in Central America are 2 of the 450. And they're not the 2. They're 2 of 450. So I think the issue of which gangs are prominent or not, it's really a law enforcement question. I think we in this field, actually would prefer not to even mention gangs by name, because that's not what we do. We solve relationships. Whether they're between Bloods and Crips and las letras y los números or whatever we want to call them, it's really about relationships between people that are somewhat misguided in their behavior, but whether they're a Blood or Crip or something else, I'm not sure that it helps us as social workers. It helps law enforcement. But the fact there are 445,000 gang members in LA does not tell any public health person in the room what to do. Because that's not what we do.
Okay. So this question came in the form of a graph and words. So let's see. So it says poverty leads to drugs and money, which is attractive to youth, leads to gang involvement, to violence. It's not just fixing the end result, but how or what can be done to target the originating problem, which is poverty. Not just target the youth, but the problem.
Well, I would say that, I mean, obviously there's a lot of contextual issues that we're dealing with in Latin America that are social inequality, poverty, lack of access to economic opportunities, to education, and these are just challenges that people face on a daily basis, and oftentimes in many of our communities here in the United States as well. But we also know that there's, again, individual risk factors that affect youth growing up, whether it's critical life events or guilt neutralization or drug abuse, a host of different risk factors that often lead a youth to get involved in gangs. That's something that we also need to address. And in the context of Central America, you just have a mix of all of these things happening at the same time that are putting a lot of pressure on youth to get involved with gangs or drug trafficking organizations, because you also have that element in the region as well, which is a lot of the drug trafficking that's coming up through Colombia, mainly up through Central America and Mexico. And so, it's like we say in Spanish, a sancocho of everything all mixed together that's leading to a very complicated and complex problem. But, I think that what we're seeing, there are solutions to these problems. And again, a lot of it is making sure that what we're doing is coordinated on the ground, and that a lot of the solutions come from the communities themselves. That's what we've seen over time, that the communities know best what solutions to put in place. So what we're trying to do as USAID is be a catalyst for a lot of the work that's already being done at the local level, whether it's opening up an outreach center or doing a youth workforce development program or working with local governments to develop their own crime prevention plans. At the end of the day, they're the ones that have to deal with it, and they're the ones that are going to solve the problem. So a lot of what we're trying to do is really work at that level to give them the resources and the support they need to deal with the challenges.
And most social scientists are a little baffled because actually gang-related violence has decreased in LA during the worst economic period of LA. So I think even the criminalization of poverty is something that we need to really look at very closely. So there is, and I don't have an answer for that, but it seems baffling to me that we expected crime to go up as the economy went down in LA, and that didn't happen.
Yeah, I'd make a related point about Latin America. Poverty has declined dramatically in a number of countries in recent years, and yet the crime rate's been going up, I think, in every country in the hemisphere except for the U.S. and Colombia. I believe those are the only two exceptions.
I always make a joke. It's not a joke. It's actually true that when I was growing up in Cuba, I didn't know that we were poor until I met the first delegation of social scientists that came to Cuba. And I ran home crying to my mother, asking her, is it true that we're poor? Because I had no idea that we were poor. So we have to be a little bit mindful of how we frame the issue of poverty. It's we do tend to criminalize it, and so yeah.
Why is behavior change so important, and how do we create that? Is it through programs or people / mentors?
Well, I have to use a musical analogy first. I think we haven't done that yet. You put a piece of piano music on the piano, it doesn't play itself. Somebody has to go in and put in the energy to make it into music. So it is people, and it is programs, but it is well-designed programs with people that are really willing to put their heart into that work. Now, in terms of behavior, I think it's one thing we can measure. There are, we keep saying here that we're focusing on behavior, not identity. It's just that it's harder to measure identity. So behavior is something you could quantify and you can measure, but for sure it takes great models, but one of my close colleagues always says to me, look, models don't work. And to some degree, it's true. I think models require a tremendous amount of personal energy and commitment. Most models fall apart at the implementation level because it's really, that's when you have to kind of roll up your sleeves and do what it takes to make them work. So I say people and programs. There is nothing LA could have done without the sweat of all the implementers in this room. And they were doing that long before GRYD, and they will continue to do that long after this conference is over, and that's a given.
Here's a blunt question, and it's a question I often get when I go up to Capitol Hill, Congress, and I'm asked about our programs in this field. How do you address corruption? If I can ask each of you to take it from the domestic side and international side.
Yeah, well, I mean, in terms of the work that we're doing at the community level, I guess I would say it's, part of it is finding good local partners that you can build relationships with that often have been vetted by others that, particularly working with local service providers, we have strong monitoring systems in place to ensure compliance with our own financial regulations, et cetera. But a lot of it is there's a networking that happens at the local level, at least in terms of understanding who's who in the community and getting a sense of, people are legit and who's doing what, where. But, obviously this is a huge issue for the region and one that I'm not going to answer in 2 minutes, but it's an overwhelming challenge that we deal with in terms of working with governments, in particular in the justice arena, and trying to improve criminal prosecutions and build justice institutions as well. That is another element of this work that we haven't talked about, but is a strong component to supporting law enforcement, prosecutions, et cetera, while we're also doing this community-based work to help youth not get involved in gangs, et cetera. So,
wow.
I mean, it's sort of, from the USAID perspective, what we're dealing with. You take a country like Honduras, for example, and it's estimated that 90% of the cocaine that arrives in the United States goes through Honduras. In part is going through ungoverned spaces, but the amount of money that represents in an extraordinarily poor country does open up potential opportunities for corruption. And obviously, no country is immune to corruption. But it does pose sort of special challenges. And are there lessons from LA or anywhere else and how to deal with it?
I think if I could speak about corruption from the point of view of a funder, because I think the GRYD office, we conceptualize programs, we develop them, we do policy and all of that, but we also are a funder. From the perspective of being a funder, I think we have to constantly examine our funding strategies, our procurement processes, to make sure we're not encouraging so-called corruption in the way that we fund communities. In other words, if an agency is not adequately funded to carry out the mission that they're supposed to carry out, there's more of a likelihood of corruption, and that seems to be the case certainly with law enforcement, the law enforcement component, that if a law enforcement personnel is not paid adequately and trained adequately, then the temptation to become corrupt is greater. So how to fix corruption in human beings, I have no idea how to do that.
We'll solve that tomorrow. Once the influx of men and women from prison began to increase, how can we help guard against recidivism if there are no benefits provided or provided for programs focused on helping them reintegrate?
I would say this is, again, one of the bigger challenges we face also in the region in Latin America in terms of particularly the juvenile justice system. Kids who are coming in and out of a broken system really that offers no alternatives to them once they come out, no rehabilitation, no reinsertion programming. And so oftentimes it's just a vicious cycle of kids who are going through a juvenile detention system where basically a lot of them are learning how to gangbang while there. And so we've had the opportunity to visit a couple in the region, and they're pretty miserable places. And you walk away just in shock that there's actual facilities in the world that are run this way. And so really, from our perspective, I think that that's one area that also needs some serious looking at and investment, and how do we provide those alternative measures to incarceration. Because again, these are eventually going to be the troublemakers, the small few who are out there committing a lot of the crimes. And so if we're over here doing a lot of prevention work and you've got a broken juvenile detention system, juvenile justice system over here, we're not doing anything about this, it's defeating the purpose. And so this is again part of the integration of both what we do on the prevention side, but also on the intervention and the reinsertion piece as well.
As it relates to youth, I'm going to use something that Skip Townsend, I'm not sure where he is, but he constantly reminds the city of LA that these are our kids. They came out of our bedrooms. They grew up in our dining rooms. And if we visit one of these places and we have the reaction that we wouldn't want our kids there, that's the wrong place to put them. And I think as far as coming out, whether they're kids or adults, we really do, it would be helpful to review if having the same programs that failed to begin with be the programs that they come back out of jail to, seems not like reentry, but more like revolving door. So I think we have to, it would be helpful if we did some evaluation of what are the programs that people are coming back into. In the case of the AB 109 population, we know that 50% of them are not even showing up to these programs. So, I don't have a full, well, first of all, I wish I'd gotten these questions when I was 30, because when I was 30, I knew everything. So, as far as, reentry, it seems like it requires something on both sides, just like the transnational work. If you're working with transnational families to address all parts of the family, you have to work at it on both sides. And I think with reentry, that's the only principle that seems to make sense to me, is can we actually address the problem simultaneously, both inside and out? We're not doing so well with that, by the way.
This next question, I think, is also of relevance both domestically and internationally. What lessons are there that can promote violence and gang prevention in places with relatively low violence and not a strong culture, but risk factors? And like looking at Central America, for example, I mean, you mentioned Belize earlier, which has relatively low crime rates relative to the Northern Triangle, relative to El Salvador, Guatemala, Honduras. Costa Rica, of course, relatively low crime rate, Nicaragua. But all those places, it's going up. Panama, we just pulled out of USAID. So how do we, in part, we're trying to better focus our resources along the lines what the mayor was saying. But how do we operate in those sorts of environments to ensure that we don't end up with a crisis?
I mean, again, I think here I would make a plug for the work that we're currently doing, which is, again, focusing on working with local governments, local communities to really build up their capacity technically to diagnose the problems, but also have them come up with the solutions. And that has worked fairly well for us as far as being able to leave something behind that we hope can be sustainable, but also where people are empowered, whether from the private sector, from government, from civil society, all working together, diagnosing the problem, and coming up with their own plan. And that's where we as an agency put a lot of our resources to build that local capacity. Because they're the ones at the end of the day to come up with the roadmap for what's going to happen in a lot of their communities. Again, they're in a better position to identify what needs to happen, whether it's more on the primary prevention front or secondary or intervention or whatever it may be. So I think going forward, that's where we constantly look to engage, is really at that local level where we've had the most success to date.
I think we were getting signs that we're kind of running out of time, so I think rather than answer that question, I would like to, what I'm hoping people walk away with from this panel is the following. Irregardless of the tremendous progress that we've made in LA, I think it's really important to keep thinking about this idea that we're not disconnected, that in fact we are connected through family with many countries that now have what's called a transnational problem. And that I think the work in LA would only be strengthened if we continue to work with our partners in other places, that is in our best interest. That is a good way of protecting the work that we have done and a good way of strengthening the families that we all work with that in fact are transnational families. You look at remittances, you look at phone bills, you look at, who's got a cousin where, all of that is what I'm hoping that we start thinking about, that this is not a Central American problem or a problem of Belize or Mexico, or this is something that we have all in this work committed to, and we have a mandate to keep expanding the lens so that we see the problem clearer. Because if we look at a problem through, if we look at a problem through the criminal justice lens, we're going to see a criminal solution to it. There's no way you're going to look at the problem through that and come up with something else. So that's what I'm hoping we'll all walk away with, that maybe it's time to start looking at this transnational problem through a different lens, one that is not exclusively driven through law enforcement.
Okay, we have one final question before we take a break. I think the donuts are arriving. We don't want to miss that. But
the cookies are here?
Cookies are here, yes. The final question is, if we want to learn more about both your organizations' great work in this field, is there a website that we can go to?
Well, yes, the GRYD office has a website, I think is GRYD LA. Where are you, Natalie? Now I'm totally exposed. Natalie Duarte knows everything about the GRYD office, okay, including the website, grydla.org. Okay. But even better than a website, I think all of the implementers that are in the room. In other words, our office GRYD is comprised of people that work in City Hall and the implementers. And so I would suggest you get information from them as much as possible if people want to know more about GRYD.
Yeah, and the same for us. I'm more than happy to answer questions and pass on more information. Our website is usaid.gov. But again, I can provide you more access to different information we have, and we also have a lot of our USAID staff from different missions in the region as well, and implementing partners that'll be more than happy to provide you with that info. But finally, I just wanted to say that it's been a pleasure to work with Guillermo over the last many months, and I'm glad he's still actually willing to work with us, because the last time we flew together was on what I would consider the flight from hell from Guatemala City to Tegucigalpa. So if you actually YouTube Tegucigalpa landings, you'll know what I mean. But this one was particularly bad because it was high wind and low cloud cover, and we got diverted to another city, and we were all confessing our sins to each other on the flight. And so,
Miguel,
yeah, exactly, and Miguel was here as well. And so I'm glad that we're actually all here still. But in any case, no, truly, it's been a great pleasure. And
it's been my honor, and not just with you, but with all of the folks at AID on the ground and some of the implementers. I think the humbling part of all this is that there are people working in conditions against odds that many of us cannot imagine getting up in the morning and having to face that. So it's been humbling. It's been very humbling. So thank you.
Thank you.